And welcome back to Ask the Doctor. I'm Mike Berger. Here to answer your medical questions on foot and ankle injuries is Dr. Paul Marciano from Academy Foot and Ankle. All you have to do, if you have a question, is call the number on your screen. That's 1-877-610-2211. Or you can visit the website at www.texasfootdoctor.org. Dr. Marciano, welcome.
Thank you.
I see you brought a little friend with you today.
Yeah, foot model.
Tell me a little bit about some of the major foot problems, and I'll jump right in with one that I think everybody's familiar with, the bunion.
Well, the bunion's a very popular problem that we have in my office. It's the number one surgery that I treat in my office. It's a bony deformity located at the big toe joint. And most people feel that it's due to high heels, mostly in women. I have kids who have it. I have men who have it.
Really?
Mm-hmm. The problem is that with the high heels, the heel presses on the bone and the nerve gets kind of sandwiched and causes the pain. And so most of the time the women are coming in because they wear the more narrow type shoes.
Sure.
And so conservatively, we always try to tell them to get wider shoes or bunion shields or take anti-inflammatories. And if those things don't work, then we have to get a little bit more aggressive. We can try injections, but that's not going to solve the problem. It only is like a temporary fix.
I want to get back to the high heels in a second, but first we have a question from Ricky calling in from Azle. Ricky, what's your question?
I have a sharp pain in my heel, and it's not going away. Any idea what it is?
Well, typically the number one thing that we deal with in the practice is plantar fasciitis. It's a band on the bottom of the foot. It's like a ligament. And once the arch falls, the band kind of gets pulled off. There's little micro tears that occur at the heel. The classic presentation for it is pain after rest, first steps out of bed in the morning, or when they sit down, get up and go. Most of the time my patients are having pain when they're walking barefoot versus walking in a sneaker. Most of the time then, after that point, when they come in, we have to get them with some type of arch support, what we call an orthotic. It's a custom mold insert that we put into their shoes. Mm-hmm. We get them with aggressive stretching, anti-inflammatories. And the next progression, if those things don't work, there's injection, physical therapy. We have also a machine in our office that we do this. It's non-surgical. It's the extracorporeal shockwave therapy. It's worked really, really well for this problem. It's about a 75% success rate with that.
Fantastic. We have Karen from Commerce joining us. Karen, how can we help you?
What can be done for bunions? The over-the-counter stuff just isn't working for me.
Well, we touched a little bit on that, but you might want to just reiterate because it is such a widespread problem.
Well, as we were talking about earlier, if the conservative therapy doesn't work, there are different types of surgical procedures that we can do. Depending on the size of the bunion, leads to the procedure that can be done. If it's a relatively small procedure, we do the procedure closer to the joint versus at the back. The smaller procedures, most of the time patients walking out of surgery. They're in a walking boot for about 4 weeks and then they get into a sneaker and we're looking at physical therapy after that. Most of the time they're back into their shoes at 8 weeks. The number one problem for my patients is not pain with bunion surgery, it's swelling. And after about 12 weeks, I'm usually saying goodbye to them and they're usually back at full activity.
Okay, I think we actually do have Karen from Commerce this time. Karen, are you there?
My question is, what causes drop foot, and is there any cure for it, and can it travel to the other foot?
Well, drop foot is usually a compression on a nerve that's usually higher up on the leg. And sometimes when the nerve gets compressed, or sometimes they don't really know the injury that caused it, like the punter for the Dallas Cowboys, he had it and is currently still suffering from it, going through rehab. It usually doesn't travel to the other side of the foot. It's only because it's mostly a compression type of injury. And it weakens the muscles on the top of the foot, which cause the back of the muscle in the leg to take over and win.
Now, we do have the phone lines open if you would like to call us, 1-877-610-2211, and we'll take your calls right away, or you can also go to the email site. I want to just get in quickly about, do high heels drive podiatrists and vascular surgeons crazy? Are you,
No, actually, I like it. It brings me business. I think they look great on women.
Here's an honest man, folks.
Yeah, it brings in business. But, I mean, typically, it's depending on the shoe. The higher the shoe, obviously, it's going to probably cause some more issues down the road. you play now, you play later. It's my motto. Okay.
Next question from Shelley in Dallas, and she wants to ask us an email question. My mom and dad are diabetic and read they need annual podiatry checkups. Is that a good idea, and why?
Well, annually, a lot of things with diabetes, it affects the nerves and the vascular system, the two top things. And most of the time, the patients, they're usually elderly, and they don't check their feet, or they can't reach the bottom of their feet, or they can't look, or they don't have anybody to look. So we ask them to come in and get checked up because when they lose the sensation, they lose their protective threshold, the pain, ouch. And when they come in, they're usually saying, Doc, I saw some blood on the floor or in my sock. And at that time, it's usually too late. They have an ulcer, and then we have to start addressing that. So we ask them to come in annually, if not even more. I have patients who come in every 4 months for routine care just to take a look at it.
Dr. Marciano, thank you so much for being
Great,
with us
thank
and
you.
explaining so many things. And thank you for joining us today. We would like to thank all of our doctors, of course, for doing such a great job on the show. Your phone calls will still be answered if you would like to call, so you can call the numbers that you see on your screen. Dr. Larry Reeves, esthetician Jennifer Schumacher from the Center for Aesthetic Surgery, Dr. John Sinkowski, Arlington Vein Spa, and Dr. Paul Marciano from the Academy Foot and Ankle Center. I'm Mike Berger. See you next time.
This program features medical questions from viewers. Nothing within the program establishes doctor-patient confidentiality.